Thank you, Madam President. That is a very, in my opinion, presidential welcoming address. I would now like to call on Dr. Adefunke Adesope, who is representing Dr. Faiza Shuaibu, to give the keynote address. Thank you.
Good morning, distinguished ladies and gentlemen. Please, I'd like to share my screen.
You can go.
Okay, thank you very much. Good morning, distinguished ladies and gentlemen. I bring greetings from my Executive Director, CEO, Dr. Fisa Shaibu. It's just because of this COVID-19 issues that he cannot be here with you today. So he sends his greetings. We are here to talk about COVID-19 following these outlines. I hope you can see my screen.
Yes, madam.
Sorry, can you see my screen?
Yes, we can see your screen.
Hello? Please, can you hear me?
Yes,
we can hear you.
Okay. So we start from the background to planning, coordination, and service delivery, data management survey. Okay, thank you. Data management, surveillance, micro planning, sorry. The outline goes like this: background, hello?
We can hear you.
Hello?
We can hear you.
Am I still on?
You are on, but I can't see the slide.
Okay, sorry.
You are on,
But can you see my screen?
No, we can't see yours.
Okay. Can you see it now?
Yes, we can now see it.
Okay, sorry. So we are talking about the background. A multi-sectoral COVID-19 vaccine introduction technical working group was established to ensure readiness for timely COVAX vaccine introduction. Members of the technical working group include all stakeholders involved in vaccine distribution and their maintenance. Federal Ministry of Health, MPACDA, NCDC, and others. The main objective of the technical working group is to introduce COVID-19 vaccine in Nigeria so as to achieve a high herd immunity to slow down and interrupt transmission of COVID-19 in all persons. For the COVID-19 vaccine, introduction has been developed and submitted is targeting introduction of COVID-19 vaccine in phases over time, beginning with AstraZeneca vaccines for health workers and other frontline workers by March. That is next month. From the background, we move to the planning, coordination, and service. The technical working group for COVID-19 shall be set up in all states and local government areas. We have the state level. At state level, we have the state coordinating team and the state technical working group, which is domiciled in the State Primary Health Care Board. At the LGA level, we have the local government areas, COVID-19 introduction coordinating platform. We have a coordinating body at the ward level, and then we have at the health facility level. The federal government of Nigeria has received multiple commitments for the introduction of millions of vaccine COVID-19 to all eligible Nigerians. And it has been promised by the COVAX facility. The federal government of Nigeria will receive over 16 million doses of AstraZeneca vaccine from the Serum Institute through the COVAX facility by March. That is what we are expecting now. The African Union has approved approximately 41 million doses of the same AstraZeneca vaccine. The government of India has promised to donate 100,000 doses of Covishield vaccine to us, doses of AstraZeneca vaccine from MTN. These are the promises we have, and these are what we are expecting as a country. The federal government will be vaccinating all eligible population, 18 years old and above, with safe and effective Sorry about my network. The network seems to. I'm back, but I'm trying to share my screen again. Okay. The federal government will be vaccinating all eligible Nigerians with safe, effective COVID-19 vaccine. And I want to add that the vaccine is free. Total eligible population of Nigerians is about 108 million, over 108 million. And this number is based on the strategic advisory group of experts on immunization that recommended that we should vaccinate for now people over 18 years old. Nigeria will deploy the TEACH strategy to vaccinate eligible population towards interrupting the COVID-19 scourge. What is the TEACH strategy? The T stands for traditional micro planning, which each local government and state have already or nearly completed doing as of now. It will involve a comprehensive depth of micro-plan approach to identify sources to vaccinate these people, 50 to 7% of total eligible population, using trained health workers. The E stands for electronic self-registration of healthcare workers. This is already ready, and it will be deployed once the training has started. The A stands for assisted electronic registration of healthcare. The C stands for concomitant registration of the general population, specifically to areas where there is poor enrollment. Very, very sorry for this, my network issues. I hope you can still hear me. Hello?
Yes, we can hear you. We can hear you now.
Okay. Okay, thank you. Hello? I'm not able to.
Dr. Adeshokwe, your TEACH strategy, yes. I think you are.
Yes, that's where I am.
Assisted electronic
I want to go to the next slide, but it's not going. The next slide, yes. The breakdown of expected allocation of COVID-19 vaccine from COVAX and African Union is as follows. AstraZeneca, over 5,600,000 doses. Who are the target people? The healthcare workers, the frontline workers, ports, air, land and sea ports, military, lab network, policemen, petrol station attendants, and any other contingency. Those are the people for the first quarter. The Q1, the first set of people that will be vaccinated. The second set that we are, by the time the vaccines come, 15,000 doses, over 15 million doses, the over 10,400,000 doses, and the 7,600,000 doses, making 33 million doses that we are expecting. We want to give it to people that are over 50 years old, especially those with comorbidity, because those are the people that are dying. As the agency has said, or the federal government has said, the vaccine will be given to people in phases. It's not everybody that will collect it at the same time. We are going to start with health workers and the frontline workers, then go to people over 50 with comorbidity, before we go to the general population and all others. Next slide, please. So we are still looking at this TEACH strategy. The priority one group is the frontline health workers and some of the people that are over 60. The priority 2 will be people that are over 50, and then some with between the ages of 18 and 48 that have serious illnesses. Priority 3 will be states and LGAs with highest disease burden. All the people in those states will be covered, at least 18 and above. Then the rest of the eligible population will be in the 4th stage. Next slide, please. Then let's go to data management, surveillance, and micro-planning. The pre-testing of e-registration and scheduling of health workers for vaccination has been concluded. We have developed a mini manual for e-registration process. It has been developed for health workers and other users. Pre-testing of e-registration was conducted at Buhari Area LGA in early February. When we talk about health workers and the being given priority, we are thinking of sharing the prioritized list of health workers with states and LGA, where we give them the direction of who we are prioritizing. It's not all the health workers. Then states and LGAs are guided to develop scheduling plan with names of health workers in facilities where they will be vaccinated. We should remember that it's not all health facilities that will be carrying out the vaccination. There will be designated health facilities in every local government in the Nigeria. A system-generated SMS sent to health workers scheduled for vaccination to notify them of the dates and venues of vaccination. A defaulter tracking system will be activated by state operations room for possible rescheduling where necessary. Next slide. The federal government of Nigeria has finalized the training manual for COVID-19 introduction, and the training of health workers will begin tomorrow in all the states of the Federation. Next slide, please. Capacity building of the workforce, especially vaccinators, will be done to deliver the COVID-19 vaccine starting this week with the national training of trainers. Nigeria has over 60,000 health workers providing routine immunization services. The COVID-19 vaccine introduction will require capacity building for this health workforce, in addition to other complementary personnel that will be incorporated. Supportive supervision is a key component which will be conducted in 3 phases at all levels: pre-introduction, introduction, and post-introduction. The training will be implemented utilizing a cascade mode of delivery from national level to the states, to the local government, and to the health facility. The core of national trainers, the master trainers, will be focal points from the Nigerian COVID-19 Vaccine Introduction Technical Working Group, other staff of MPHCDA and partners working at national level. To ensure safety of participants, IPC will be fully implemented in all the NCDC guidelines during on-site training. We should remember that we have already been doing vaccination in Nigeria. So most of the things are already available. Most of the workers are already trained. It's just to upgrade their training concerning this new vaccine and concerning the safety procedures. Let's go to vaccine safety, cold chain, and logistics. Next slide. There are sufficient cold chain equipment in the country to accommodate all the expected doses of AstraZeneca and Johnson COVID-19 vaccines at national, zonal, and state levels. There are a lot of fears concerning this, how the vaccines will be kept and things like that. But we should remember that Nigeria has been giving vaccines and it has been working for more than 30 years now. And there are people on the ground to do it, and there are equipment on the ground to bring it to pass. Next slide. The storage of the AstraZeneca vaccines from COVAX. The vaccine can be stored for 9 months at +2 degrees centigrade to 8 degrees centigrade, and for 30 days and 25 degrees centigrade. The study is still ongoing. The vaccine national, zonal, and state cold stores. At the HGA level, the vaccine will be stored in vaccine refrigerators. Health facilities with solar cold chain equipment will also store vaccine during implementation. Next slide, please. Distribution of COVID-19 vaccine. The COVID-19 vaccines and supply will be distributed through a push system from the national level to the zonal cold stores, and from the zonal cold stores to the 36 states. It is the states that will now distribute it to their local government. The plan is what it obtains for vaccines that we have been distributing before. So it's not a new thing for the agency. Distribution will be funded by the federal government through third-party logistics firms. The distribution will be based on verified microplans submitted by states, which can be monitored. The bundle vaccines will be distributed to local government cold stores during implementation and to health facility with cold chain storage capacity. The vaccines will be transported in cold boxes using conditioned ice packs as the coolant. Each cold box will have a freezer tag because AstraZeneca vaccine is freeze sensitive. Next slide, please. Risk communication, demand, and demand generation. Next slide. Risk communication will be, and demand generation will be taken in phases. And it has already started since January by the agency. Before the vaccine arrives, we are engaging experts. There are a lot of things going on now. We are engaging experts to also sensitizing stakeholders on what the government is doing. We are using different channels: TV appearances, short videos, newspaper interviews, social media, and meetings. And I believe this is one of the channels. When the vaccine arrives in the country, we provide evidence of vaccine acceptance by maybe immunizing some people for others to see. We mobilize communities and create awareness and demand for vaccine using the same channels. Post-vaccination, we will follow up on vaccination people to give testimonies of what is happening to them, and then produce evidence of vaccine safety and efficacy and post-vaccination wellness using the available channels. Next slide. I just want to say that there are a lot of fabrications going on in the country now. So many things on WhatsApp, so many fears people are raising. But we should remember that Nigeria has been giving vaccine for so long, and there are people trained in handling vaccine already in the country that have been doing it for so long. We have put in place things that will help us to be able to give Nigerians vaccines that will work, vaccines that are effective. And at the same time, I want to say, from the federal government, the vaccine is free. So there is no need for fears that it will be expensive or whatever. The vaccine is free from the federal government of Nigeria. Thank you very much. And sorry for the itches.
Thank you very much, Dr. Adeshokpe, for your very detailed presentation. The presentation especially addressed issues of equitable distribution more than any other issue. I think a lot of people's fears are already addressed, especially with your last statement that the vaccines is going to be distributed free. I'm particularly happy that they said the first set of people that will get the vaccine are the health workers. So I can look forward to getting the vaccine very soon. Now we go into the panel discussion. And the first panelist that I would like to call is Dr. Walter Molombo, the country representative of the WHO. But he's unavoidably absent, held up in a meeting somewhere. And Dr. Geoffrey Namara, acting COVID-19 response incident manager, acting cluster lead, emergency preparedness and response cluster WHO, is taking his place. Dr. Namara, are you here? Dr. Namara, can you just say hello if you are with us now? Okay, while we are trying to find Dr. Namara, Dr. Oladonyi Odubanjo of the National Academy of Science, would you like to address some of the issues with COVID-19? Fears, facts, and equitable distribution. Dr. Odubanjo, please.
Okay, thank you very much, Dr. Ibitomi. And thanks to the LCCI leadership. Thank you for the invitation. I also stand on all the protocols, as it were. But let me also give an apology ahead that I'm actually hosting a meeting at 11. So I'll also have to leave before the questions and answers probably. However, a few comments. I must thank the previous speaker for sharing some of his details. I had one or two questions, but I'll probably type them in hopefully before I go, from what they are doing. But one of the key things looking at COVID-19 and how things have played out in the last 1 year plus is that it's a big lesson in science communication, which is that how do you communicate scientific complexities to the general populace in order to ensure their cooperation. Now, we've dealt with just the containment for so long, but now we are dealing with the vaccines. And I think that same thread, that same issue threads through everything, which is that it's in clear communication, what we call science communication, that we get the impact that we need to get. We get the cooperation that we need to get. Much of what we are dealing with facts, fears, and equitable distribution will be underlined by this ability to communicate the science clearly. I once shared a video on the technical group platform, and somebody immediately dismissed it. Oh, this is an anti-vaxxer, which is somebody who is against vaccines, so we shouldn't listen to whatever they say. And I said, no, that is exactly the wrong approach to it, because whatever they are put out there is what people are going to listen to. And these people also have some credentials. I said, so what you do is that you listen to what that person has to say, because that tells you what the concerns will be in the public. And then as best as you can, you are going to explain to the public what are the issues that counter that, scientifically speaking, and it's when you do that that you get the cooperation and you can allay the fears of the public. So smart science communication must be succinct, must be simple, clear, and accurate. And it also includes being honest, especially about what is unknown. And I think that is one major factor in COVID-19, apart from anything. I chair the African chapter of what is known as the International Network for Government Science Advice. So we look at science advice in general, and that's a key point in science advice. If you're advising government or other stakeholders or general public, don't overestimate or suggest that you know it all when you don't. So we must make it clear that certain things are unknown. So breaking it under the theme of what we're talking about, I assume I have just about 5 minutes actually. Talking about the facts, just like the previous speaker closed, the fact she closed on, we've been using vaccines for a long time, so they are not new. So the fact is that vaccines are not new, and they are used to reach what we call a herd immunity, which is that you want most of the population to have immunity against a particular organism, so that when that organism is jumping from person to person, it reaches somebody that has immunity and therefore cannot continue to move. And hopefully, if you have enough people with immunity, then that organism dies in the last person that it infected. It's not able to go on running through the community. So that's what we're trying to achieve. And in this case, there have been a lot of discussions about achieving that naturally, meaning that you want people to just get infected naturally, or do we need a vaccine? So many people have asked, do we really need a vaccine? The point is, you could reach it naturally. Yes, you can, but at what cost? So with a vaccine, you can get more people to have antibodies or have immunity against the disease without having to lose too many people, and hopefully not losing, of course, somebody's loved one. So you don't want to lose people. That's what you are trying to do. You want to have that immunity without losing people. You want to reach there faster, and safer. And one of the questions people have is, how many people have to have that kind of immunity for you to reach that immunity. That is not known really. Maybe above 60%, some have suggested, some have said 70%. The NCDC and the Institute of Medical Research just released a report which suggested the highest states with immunity in the study was Lagos and I think Enugu, which had 23% of people with immunity now already against COVID-19. But that is still far away from 60% even. So it means that you still need many more infections and therefore many more deaths and severe, sickness before you can reach there. So that's the case for vaccination. So speaking about fears, there are several of them that are out there. One of them is that people are worried about new technology. So one of my questions actually was that the first 100,000 doses of vaccine we're being told about were going to be Pfizer vaccines. And that's where the controversy of cold storage began from, because the Pfizer vaccine needed to be stored at -70 degrees centigrade. That's where that came from. I'm actually particularly personally happy not to be hearing much about the Pfizer vaccine from MPHCDA, and seeing that we're putting more emphasis on other vaccines. And that is good because we can manage that better. We have a more functional cold chain that can deal with the AstraZeneca vaccine they're talking about, for instance, than dealing with the Pfizer one. Not only so, people are also worried, that if you use a vaccine like the Pfizer one, it's new technology, the way it's developed is new, it's different, it's not been done before. What's the long-term effect? Now, in science communication, I've had several experts trying to say, oh, there are no effects, it's safe, it's this, it's that. And I tell people, no. In science, you have to be honest, which is if something is new, you cannot say 100% with 100% certainty that it is 100% safe. What you can say is, as far as science can tell, it is safe enough. However, just like any new drug that you introduce, you will continue what they know as pharmacovigilance, simply meaning you continue to watch that drug. Many drugs have come out in the market. You watch them for years. They don't come up with anything that you don't desire. And so they stay in the market. So it's the same way. You introduce new technology, you keep watch on it. But before it gets introduced at all, there has been a rigorous process. If it did not survive that rigorous process, it will never make it to the market. That is the assurance that we have, and that's the only assurance we can give. Second worry people have is the effect of strains, and I see somebody has put that up in the question box. What's the effect of the different strains on it? Again, the COVID-19 virus, they cousin to the flu virus, and basically they change. And Not all the changes are damaging or very worrisome, but some can be. So it depends on what kind of changes happen. But so far, as much as the vaccines, existing vaccines and the ones in development are known, it's known that the vaccines should protect at least from severe disease and death, if not completely from infection. So I think that would also suffice there. Then people worry about vaccine contamination. We suffered that with polio in Nigeria, where people said they put something in the polio vaccines to sterilize people. And so people were rejecting it. But thankfully, again, NAFDAC now is speaking. And that's how you address those fears. That look, anything that comes in is going to be screened by NAFDAC before it's allowed in the Nigerian communities. And that's the kind of reassurance we need to be giving people. And of course, there are religious concerns, which you need a number of religious leaders also to pitch in on, to allay those fears. So I'll just say last word on equitable distribution. And that's to say that we've seen that it's a major concern. Again, maybe I'll throw in my little second issue here, which is that looking at what MPACDA presented, an immediate question in my mind and maybe in other people's mind is that why in Q1 are you having petrol station attendants receiving vaccines before people who are above 50 years of age and people with comorbidities in Q2? So those are the questions about equitable distribution. Who gets it? Are the right people going to get it, and are they going to get it at the right time? Biggest threats for us will be corruption and, of course, the Nigerian big manism. They're not just Nigerian, actually. We've seen in Argentina, the health minister to resign because his friends jumped the queue. In Spain, several people have resigned, including a top general, because they jumped the queue. So what we'll expect is that there'll be consequences when people do not follow the plan and jump the queue. So on that note, I hope I've been able to make a few points that are valuable to solve. Thank you.
That was a wonderful delivery. I particularly like the last part of your speech, where you're talking about what happens to people who jump the queue. It's a very peculiar problem we have in Nigeria. Everybody wants to jump the queue. So I hope the authority that's B is taking note of all this. If people are allowed to jump the queue, everybody will want to jump the queue. At the end of the day, nobody will get what they are supposed to get. I think Dr. Geoffrey Namara is on now, representing the country manager, WHO. Dr. Namara, are you with us now?
Yes, I am. Thank you.
Thank you. Can you give your own take on COVID-19 facts, fears, and equitable distribution? Thank you.
Thank you very much to the organizers of this very important event. I bring greetings from Dr. Walter Kazadi Mulombo, the country representative of WHO Nigeria, who has been held up in several other unavoidable commitments, but wished very much to be part of this, and indeed does wish to be part of this. He has actually been able to join now, so I will check with him in a minute if he will be taking this on or if he would like me to continue. So
okay, so you can check with him, and you can send the panelists a chat as soon as you are ready. In the meantime, Dr. Babata, I understand you've been kept awake all night. I know in Texas now it's much earlier. Can you tell us about fact, fears, and equitable in COVID-19? Dr. Babata.
Thank you very much, Dr. Ebitomi. I have a couple of slides that I would like to share because I kind of address this. So I'm going to share my screen and really what And really what I will do, there are some of the items on these slides that other participants have already talked about, so I will not go over them again. So my goal really is just to kind of address some of the concerns people have with the vaccine. So we all know COVID is essentially raging the globe. There's more than 100 million cases right now with more than 2 million deaths. That's not a surprise to anyone. What we have so far reported on Nigeria is about 150,000 cases with 1,800 deaths. So that's what we have. This is from the Johns Hopkins website. Some of the questions that had come up earlier was about, are the vaccines going to be effective against variants? And just like Dr. Odubanjo was saying, we don't know. There's so much we don't know. The Pfizer, Moderna, AstraZeneca, all those vaccines trials were done before the question of variants had really come up. But the nice thing is the Johnson & Johnson vaccine, which we expect to work, has a better cold storage, which would be one of the options that we would be looking at in Nigeria, in addition to the AstraZeneca, has been shown to be at least 57% effective against the South African variant. So that is kind of good information that we have. So with time, we're going to get more and more information about whether or not the vaccine is going to be effective against variants. I would say who should get the vaccine? Anyone who is eligible. The hesitancy of the vaccine is not just in Nigeria. As you can see, this was a study done in the United States. Before the vaccine was available, 42% of people wanted the vaccine. Now that in November, when it was coming closer, that number fell down to about 29%. So I will say the vaccine concerns are everywhere. One of the reasons why questions people have are herd immunity. I'm not going to go into this too much because Dr. Odubanjo really did a good job talking about this. I think the biggest question everybody has is about the side effects. So I will talk a little bit about side effects that we know from the Moderna and Pfizer. I know that those are not the vaccines that are going to be primarily used in Nigeria, but I feel like information we have on those may make us feel more comfortable in knowing what to expect with the other vaccines. So the trials that were done actually did not include people who had anaphylaxis. So it's kind of interesting, like once the vaccines rolled out, we started to hear reports of anaphylaxis, which were not as present in the clinical trials. Just because in clinical trials, as you can see highlighted here, they tend to exclude people who have a history of anaphylaxis, which is like a severe reaction to the vaccine. But what are the side effects most people have? So this is from the first dose of the Pfizer vaccine. Once you get your vaccine, expect to have some pain, redness, swelling, fatigue, fever. You can see the numbers here. The numbers of all these things are pretty high. So these are all things to expect. Vomiting, diarrhea, muscle pain, joint pain. Those are all common side effects of the vaccine. But most people for the Pfizer vaccine either had mild or moderate side effects. And as you can see on the right side, the incidence of severe side effects was low. This slide here just shows side effects of the second dose to the vaccine. And then here you can see the Moderna vaccine. They reported any reaction or severe reaction. Again, pain at the vaccine site is very common: redness, swelling, swollen lymph nodes, fever, fatigue, headache, muscle pain, joint pain, chills, nausea, vomiting are the kind of side effects to expect. But as you can see, severe side effects are low. Any visit to the emergency room or hospitalization was just about 0.1%. So, but those, beyond that though, I'm sure you guys are seeing the things that go viral, right? So all these viral videos, all this misinformation you see on YouTube, on WhatsApp, it's typically somebody who has a severe adverse effect. So how common are those? This was a study that was done for the mRNA vaccine. So the Pfizer vaccine and the Moderna vaccine. And what they found was, I think I have it's clearer on the second slide. There were only 11.1 per 1 million people who had anaphylaxis for the Pfizer vaccine, and 2.5 per 1 million who had anaphylaxis with Moderna. So you can see these percentages, these are really, really low. So these are the people who had severe side effects from the vaccine. No deaths were reported from the vaccine. Again, ongoing, as Dr. Odubanjo was saying, we are continuing to monitor these. Like actually, when you get your vaccine, you are encouraged to enroll in a registry. So if you have any side effects, you are able to report them. And we only know what we know so far. The vaccine has been out since December, but even from then till now, we're able to report what we expect in terms of short-term side effects. So as I said, no deaths have been reported. Now compare that to the case fatality rate of COVID-19. In the United States, for instance, that's about 1.8%. So if you look at the risk of side effects of the vaccine and you look at the risk of death from COVID-19, you can see that the risk is pretty significant. Over here, you can see in terms of anaphylaxis, it was commoner in females. Most people who had an anaphylaxis had it within about 30 minutes. And most people had, most of the people who had anaphylaxis are people who are actually known to have side effects, known to have allergic reactions. So maybe allergic reactions to food, allergic reactions to medications and things like that. So this is things to keep in mind as we start to give out the vaccine in Nigeria. So that's kind of what I wanted to say. I think the biggest concerns people have, in Nigeria, the burden questions people have been asking are, most of us are going to have mild or mildly symptomatic cases. The thing is, it's hard to predict who will have what. If we could predict for sure, who was going to have a severe illness, then you can decide whether or not to take the vaccine. But again, as one of the other speakers mentioned, at what cost, right? So maybe you have a mild illness, but your neighbor or one of your family members has a severe illness or ends up dying from the disease. So really, to be able to put this under control, we definitely need to advocate and get the vaccines. And as you can see here, this slide here just shows that your risk of death from COVID-19 increases as we increase in age. In the United States now, we've had about 500,000 deaths from COVID-19. In this paper, they were showing that actually that could be up to, the number of people who have died from COVID-19 could be up to the inhabitants of the city of Atlanta. So I am going to conclude and say, I got my vaccine. The side effects I had are pretty much what they described there. The pain, fatigue, tiredness, it really does not last more than 24 hours. I will say all the doctors that I work with in my division, we've all got the vaccine. So pretty much all of us are adopting the vaccine, and I would encourage us to do the same. Thank you. That's all I have.
It's wonderful, Dr. Babata. It's so comforting to know that people are taking the vaccine, no death. I particularly saw many of those reactions and what they show. And of course, the doctor in me knows that even some people react to water, So it's not you just see one picture and then say, hey, it's that. But I'm happy that a lot of people are here and they are also getting the education. Hopefully during the Q&A session, we'll be able to address some more of these fears. Okay, so Dr. Namara has confirmed that he'll be taking the session for the WHO. Can you go ahead now, please?
Thank you very much, Dr. Shegun, and good morning, colleagues. My name is Geoffrey Namara. I am from the WHO Nigeria Country Office. I bring greetings again from IWR. So with regard to this, first, to give you a global picture, as indeed has been shared by Dr. Babata, we are now just over a year into this pandemic, and we are now looking at over 110 million cases globally and about 2.45 million deaths. We very much know that the Americas region has taken a broader share of this pandemic, but neither has the Africa region been spared. Now, moving on to Nigeria. Nigeria has had the third largest burden on the continent, with now in excess of 150,000 cases reported and 1,800 deaths reported. Now, these are not just numbers. These are friends, these are colleagues, these are part of us. With particular focus on the vaccines, WHO and partners came up with the Access to COVID-19 Tools Accelerator, as you may have known that. And part one of the pillar is on the vaccines, which is called the COVAX. I'm sure many of you have heard about the COVAX facility. This is a coalition with CEPI, Gavi, and the WHO, alongside other key delivery partners such as UNICEF. Now, COVAX's main aim is to accelerate the development, the manufacture of COVID-19 vaccines, and to guarantee fair and equitable access to every country, not just to the rich countries, to every country in the world. So this directly addresses your key point around fair, equitable distribution, not just to the wealthier countries, but also to the third world countries such as Africa. Indeed, the global collaboration through COVAX has led to a significant effort in getting this pandemic under control using the vaccine initiative or using the vaccines as a key intervention. Up until now, we are aware that the WHO has granted emergency use listing to the Pfizer vaccine, and recently last week to the initially to the Pfizer vaccine and recently to the AstraZeneca vaccine. We have come to appreciate that this pandemic is unprecedented, with significant learning and new information coming out every other day. The people who have received this vaccine have had it for not more than 3 months now. And as we try, as time goes on, we learn new information from all the publications that are coming out routinely. So what is WHO's key message with regard to vaccines? One, it is clear that this pandemic has a long way to go. We have seen in many countries, intense transmission is still ongoing, and therefore putting enormous pressure on hospitals, intensive care units, and even health workers. We saw from NCDC's seroprevalence survey, antibody prevalence survey released yesterday, that about 20% had only antibodies for COVID. That leaves the 80% of the population still susceptible. Whereas by far and large, symptoms may not be severe for the bulk of the population, but there will be those in which they will be severe and have grave consequences. So therefore, decisions made by leaders and citizens in this year, in the coming weeks, will determine how we will end this acute phase of the pandemic. We have also appreciated that vaccines will be a critical new tool in the battle against COVID-19. As we have seen, there is so many vaccines in development. The different pharma are working as quickly as they can. Scientists have collaborated from across the world and are innovating new tests, innovating to bring us tests, treatments, and vaccines that will collectively save lives and end this pandemic. So we, as WHO, support efforts that are geared through the COVAX initiative, that are geared towards bringing a safe and effective vaccine against this pandemic. We have appreciated that these vaccines will be a game changer, but for the foreseeable future, it is very clear that we must continue adhering to these non-pharmaceutical interventions, such as wearing masks, such as physically distancing, such as avoiding crowds. And even when the vaccines do come on board, we need to continue adhering to these interventions. We have seen the effect of this pandemic on the economies. It across board has been immense. Not only have the first world countries had a significant slump in their economies, even the third countries have also had the same. And therefore, not only will vaccines help save lives and stabilize health systems, but they can help to drive the global economic recovery that we also wish to have. The recovery will not only take place if half of the world is hamstrung from the economic fallout, but if every other country on this planet is having access to the vaccines. As I wind up, we call on governments, we call on private sector, we call on everyone that significant political and financial commitments will be needed from all partners and governments, because we've seen that without them, delivery of these vaccines to everyone and everywhere may not be achieved in the shortest possible time so that we can end this pandemic. With that, I thank you very much. Over.
Thank you very much, Dr. Namara. It's very comforting to note that the WHO is also very focused on equitable distribution, especially not just for the rich countries, but also for the not so rich countries. I don't believe there are any countries poor, actually. So we now go to the Q&A. So there have been so many questions in the question and answer session. The first one I would like to bring is by Dr. Ademola Denloye. And I think the best person to answer this would be Dr. Adefunke. So he said, good presentation on the vaccination plans. Is the private health sector going to be involved in this process? And is private healthcare workers captured in the data on frontline workers to be immunized? Dr. Adefunke, are you still here? Can you help us with that?
Yes. The first thing I want to say is that private healthcare workers are healthcare workers. The people to be captured will be captured by the state. And each state will bring out the electronic registration for health workers. So it is for the health workers to register themselves. I think it's going to be passed through WhatsApp or whatever. Once it comes out, all health workers to register themselves, then automatically it will tell them whether they are eligible or not. Private healthcare workers are part of the healthcare workers being considered. And the second one is the second question. If they are going to be involved in the process, I want to say that depends on the state. If the state feels that the public workers cannot do it alone, they will involve them. Because if a private healthcare facility is already involved in vaccine immunization processes in the state, I don't think the state will exclude them from this. Over.
Thank you. In other words, a lot of the answer to this question will come from individual states, especially in the area of process delivery. But
yes.
Fundamentally speaking, private health workers are also health workers. As a matter of fact, according to the Business of Health by IFC, over 70% of the healthcare in Nigeria is delivered in the private sector. So I would like to think that they should be seriously considered. Okay, going on, Paul Hogan asked, can you please advise if any Chinese manufactured vaccines like Sinopharm or Sinovac are being considered for Nigeria? I'd like to add that maybe in the second or third phase of this vaccination, but this first phase, I think we are just talking about the AstraZeneca.
Yes.
Yeah. So we are not considering this Sinopharm and Sinovac for now.
Yes.
Okay. Paul Hogan. I hope you get that. The next question is from Becky Agu. What roles does a retiree play in the fight against COVID-19, knowing that he or she is not anywhere to be had? Maybe Dr. Namara should answer this.
Is that in response to Becky's question?
Yes.
Thanks, Becky. What role does a retiree play in the fight against COVID-19, knowing that he or she is not anywhere to be had? Well, first, a retiree, it's not true that a retiree is not anywhere to be had. We all have a role to play in the fight against COVID-19, irrespective of who you are. As a retiree...
Dr. Namara, you are breaking.
Oh, apologies. Is it better now?
Yes.
Okay.
Oh, Dr. Namara, we didn't hear most of what you said. If you can take it again.
I hear you very clearly.
Okay, so probably it's
so that's fine, Becky.
Connection. So I was saying that everyone has a role to play in the fight against AIDS. So rather against COVID-19, sorry. As a retiree, what literature shows us is that the risk for progression to severe disease is a little higher. So my appeal to you, one, is please, please, please adhere to all the NPIs that the government is putting out. Ensure you wear your mask, ensure there is social distancing, and all the others as have been outlined. You also, as an adult, can play a critical role to the younger generation, to the children in the home, to push them to adhere to these NPIs, because they will probably listen to you better. So that will be key. You will have saved yourself. At the same time, you'll have prevented your children and grandchildren from catching COVID-19. Over.
Okay, Dr. Namara, next question is specifically directed to you by Abimbola Macaulay. So it goes like this. Dr. Namara, from research, what is the longest time the antibodies after contact with COVID-19 stays in the body?
Good question, Abimbola, and indeed this has been a common pertinent question around how long do we have this immunity, how long does it last? What we've seen from available research is for now it is in the region of 5 months and above. However, I must quickly add that emerging information comes out almost every other day. So we are all in a learning phase. It's a new pandemic, unprecedented and previously seen. So as new information comes out, we will communicate at global level, and indeed the NCDC will communicate should there be new information. I hope that answers the question.
Thank you, Dr. Namara. For those asking whether they'll get the slides or the recording, just look out for them at the website of the Lagos Chamber of Commerce and Industries, which is www.lagoschamber.com. So you will see the materials there shortly. Olayinka Ogundeji says that, thank you for this timely and educative webinar. What is the efficacy of the vaccine? Had the South African strain is resistant to AstraZeneca, has there been cases of infection even after vaccination, as there have been cases of infection even after naturally acquiring the infection? Maybe Dr. Babata would like to attempt this.
The question is about the efficacy of the vaccine, right?
Yes.
Okay.
I think you mentioned
Yes,
that.
yes. So I think it depends on what we know so far. The Pfizer and Moderna have 95% efficacy. The AstraZeneca, I have to look at the slide, but I know that the Johnson and Johnson one is the one where they've actually looked at the effectiveness, the efficacy against some of the new variants that came out. So for instance, the South African strain, and I think it is about 52%. You know, a lot of these strains have just started coming out. So a lot of them came out after the vaccine trials were done. So this is going to be, I'm sure there's ongoing research that is being done to find out, you know, how effective the vaccines are against these new strains. But that's the reason why we really want everybody to get the vaccine, because the more the vaccines, the more the viruses reproduce, the more they are going to mutate and the more variants we have. So the more people that are vaccinated, the less mutations we'll have and the less chances for the vaccines not to be effective.
Okay, great. Jerry Momo said it's very similar to the last question, but this is directed, I guess, at Dr. Adefunke. So I'd like to know the reason for the choice of AstraZeneca vaccine in Nigeria, knowing that based on genomic studies in South Africa, they have excluded this particular brand. So Adefunke, any reason for AstraZeneca in Nigeria?
What I want to say is that the decision to accept AstraZeneca in Nigeria is not only Nigeria's decision. Other stakeholders were brought in, and through the presidential task force, the decision was made. As a civil servant, I cannot say I have a say in that per se. But the decision was taken for the best of Nigeria at the time it was taken. As Dr. Babata said, before the different strains started coming out. That is what we have to understand. And the strain in South Africa for now is not really in Nigeria. So, and the vaccine is just coming in. I think by the time we start using it, different things and different results that come out, then we'll be able to change decision. But for now, that's the strain that has been recommended for Nigeria by the Presidential Task Force and then the Task Force of COVAX. Over.
Thank you, Dr. Adeshokwe.
Can I add on something to that?
Okay, go on, Dr. Namara.
So, yes, there has been this question around vaccine, particularly the AstraZeneca vaccine on the South African, actually the B117 variant. Yes, it is true that preliminary analyses have shown a slightly reduced vaccine effectiveness. However, WHO currently recommends the use of AstraZeneca vaccine in countries such as Nigeria and several other countries where there hasn't been significant evidence or where there hasn't been widespread transmission of the B1351 variant. Nigeria has done significant genomic sequencing, as you might have seen on communication that recently also came out from the NCDC, where there have been about 55 different lineages of the SARS-CoV-2 that are circulating in the country. What of those that have been done, the B117 variant of concern, which is the one that was first described in the UK, is what has been picked up here. And the AstraZeneca vaccine is still efficacious on that variant of concern. So I would say we as WHO still recommend AstraZeneca. Over.
Thank you, Dr. Namara. That was a very strong recommendation. I'd like to take Mr. Olabode Ulumoto's question here, although he asked it in the chat box, but it's very relevant to what we are talking about here. He said, is there any effort whatsoever in Nigeria to develop a homegrown vaccine for Nigeria? In spite of the best efforts of COVAX, vaccine nationalization is a reality even amongst the developed world, and numbers expected to be sent to Nigeria will take several years to adequately vaccinate the majority of Nigerians. The best person to have answered this would have been the doctor from the National Academy of Science, but he's no more here. But I don't know if Dr. Adesope can answer this. Why are you doing that?
Yes, there are efforts, I will not call it homegrown, but there are efforts being made now to resuscitate vaccine production in Nigeria. So the vaccines to be produced will include the COVID-19 vaccine. With the emergence of this COVID-19, the federal government, I know, has released some money for vaccine production to begin in Nigeria again, because we used to produce vaccine before. So I believe that when they start, then they will start thinking of doing the doing the Nigerian specific vaccine for COVID-19. Over.
Okay. Lizzie is also asking if we can consider Nigerian home production. I guess you just answered that. Samson Adeleke is in any room for procurement of vaccination by private institutions as a way of contributing to the task of vaccinating the populace. So Dr. Adesope, have private organizations allowed to procure these vaccines?
Because of the peculiar situation of Nigeria and a lot of fakes that are around, for now, it is not advisable. But private organizations can go through the PTF to procure the vaccines, but to procure it on their own, it is not advisable. Because I know by this time the government starts giving the vaccine, announcements will go out that any vaccine not taken from the state cold store may be fake. So the government is not encouraging it, because Nigerians are peculiar people. That's just what I will say. So we have to be careful. Over.
Are there plans, this is from Chidi Ebere, are there plans for recipients to show proof of vaccination after vaccination? This goes to all those conspiracy theories that there will be a mark, and if you don't have the mark, you can't travel, you can't. So is Nigeria going to say you've taken a vaccine, you must show? Is that part of the plans, Dr. Adesope?
That's the federal government plan, which I cannot talk about. But I do know that once you collect vaccine, there are cards given to you that you have collected so vaccine. So the cards is part of data management. They are already being produced. So they will give you the card to show which vaccine you took and when you took it. But as for government regulation, I can't speak for the government on that side. Over.
Okay. I think we just take one more question because time is fast spent. And take this from Taufikat Ali. Said, what effort is Nigeria making with regards to continuous surveillance and typing of the local strains, which will be helping in deciding on choice of vaccine? I would like to add in the future. Maybe Dr. Namara can make some comments on this.
Indeed, we must appreciate the government and agency mandated with this, the NCDC and partners such as NIMA and say age seed. A lot of effort has indeed been done on genomic surveillance. As I had earlier mentioned, the country is conducting genomic sequencing and has been sharing results with the global databases. Up until now, over 400 viruses have been sequenced and will continue to even scale up this effort. What I'm aware of is a coordination group has even been formed to strengthen these efforts and do this on a routine basis going forward. So the future looks bright for the country in terms of doing genomic surveillance.
Thank you, Namara. That's wonderful. We have now come to the end of the Q&A section. Next is vote of thanks by Mrs. Boroji Osindero. Mrs. Osindero.
Thank you very much, everyone. It's been quite an interesting and enjoyable and certainly very informative session. I would like to start off by thanking our chairman of the medical group, Dr. Lee Osamilui, and our president of the Lagos Chamber of Commerce, Mrs. Toke Mabogunje, for this for putting together this very informative and very much needed seminar on COVID-19 vaccinations. I would like to especially thank our keynote speaker, Dr. Faisal Shawi, ably represented by Dr. Funke Adeshope, for accepting our invitation today. Thank you for sharing the information on how the vaccinations will be distributed. I think the TEAT strategy has shed a lot of light on that for us. I'm also sure we've enjoyed the panel discussions, and I would like to say a very big thank you to all the members of the panel for sharing their work, their findings, and their opinions with us today. Dr. Walter Kazadi Mulombo, thank you very much. It's clear that the vaccinations are going to be a game changer in our battle against COVID-19. Not forgetting the lifestyle changes of keeping our masks on and avoiding public areas, largely populated areas. I'd like to thank Dr. Oladu Dubanjo. I particularly enjoyed your discussion on the very simple explanation of herd immunity and how this will be used as an important way of, or rather how the vaccination will be used as an important way to achieve this. Dr. Kike Lomo Babata, I thank you for sharing your own experience of taking the vaccinations and also sharing with us the expected effects of what we can expect following the vaccinations. I would like to thank our invited guests who have taken the time out to listen to the webinar today. And lastly, the remaining members of the medical committee and all members of the council. I would like to leave us all with the message today, and that's really that we all have a part to play in this fight against the COVID-19 pandemic. I think it was a very good session for us because it's provided us all with a lot of knowledge, and I hope we can all go forward and share this with our friends and family, letting them understand the importance that we all play as individuals and as Nigerians to ensure that we are able to put this pandemic to rest as soon as possible and avoid losing any more loved ones. And so without much further ado, I thank you all again and God bless.
So thank you, Mrs. Osindero. And with this, we've come to the end of this program. It's been wonderful being here with everybody from all parts of the world, been thoroughly educated and informed, and I believe most people are. So thank you, everybody. I'm sure when we have more programs in the Lagos Chamber of Commerce and Industry, you'll be very happy to attend. And have a wonderful day. Thank you. Over and out.